Well, during the surgeries, they don't feel anything. Their scalp is completely numb. Even though they're relatively awake, we don't put people to sleep for this. Sometimes we'll give them a mild sedative in the beginning of the surgery. It helps them relax a little bit. But they're awake and alert, and that's the safest way to do this. Putting somebody under a general anesthesia or sedating them more significantly adds a lot of risk to the procedure, so not necessary for a hair transplant, even if it's an all day of hair in a large procedure. The other thing that's really important, and I acknowledge the patients, is really everybody's nervous system is wired a little bit differently. So your experience of pain and mine, even with the same painful stimulus, might be totally different. You might say, well, that doesn't hurt very much, and I might, really be screaming and saying, ow, stop. But in this case, what we've been able to do is develop anesthesia techniques for delivering a local anesthetic by using vibratory stimulation and adjusting the concentration and the buffering of the anesthetic, so the solution doesn't cause a lot of burning. The pinpricks are minimal, if at all. So the anesthetic process becomes very much smoother, and people say, well, gee, that was a lot easier than I thought it was going to be.
How was the anesthetic part of it?
Oh, it was fine. I didn't feel anything.
Okay. What was it like for you when you were getting the anesthetic put in?
Just pinpricks, nothing bad.
Pretty tolerable?
Yeah.
Okay. Was it better or worse than you expected?
Better.
So they're really left to, watch the TV or listen to music or sleep a little bit. So it's a fairly relaxing event. So I think it's rare, highly unusual, to have somebody who comes out of this procedure and finds that this is as bad as I thought it was. I can't remember the last time I've heard that. The overwhelming refrain is, gee, that was a lot easier than I thought it was going to be, which is great. The physical activity part is probably the most important, and if your job involves physical activity, you're manual labor, or you do the kind of job that requires you to be in and around tight spaces where you might bump your head, that's a different story. For the most part, we just prefer that people stay away from any intense physical activity for a week, 10 days. That gives their scalps a chance to heal. They won't put themselves in any situations where they might accidentally bump their heads, perhaps, and cause some trauma to the new grafts. But other than that, it's really if somebody does a desk job or doesn't have the kind of job that requires a lot of physical activity, they can usually go back to work in 2-3 days.